social assessment, care practices by present oral problems, golf culture of scary broken teeth, health ISIS, check if the client actually works after, yes.
Yeah, you were impressed. Couldn't leave me alone. Text me every time that you pick up the phone. And I had control on the driver's
Prior to performing the procedure, please hear the client why you can understand and how she
Now the
affects you.
tables have turned.
Provide our light and control the curtain, closing the door. Before calling to the client, perform hand hygiene, alcohol rub.
Tables have turned. Tables have turned. Tables have turned. Tables have turned. I used to be chill. Now I can't catch my breath. When you say my name, I feel tight in my chest. Can't handle the space. I need you here by my side. You make me sweat in the coldest of nights, yeah. I had control in the driver's seat, but my hands are slipping off the wheel. Now the tables have turned. Now I'm up all night. I'm picturing you acting like a fool. I'm on the other side. You're like a full moon, and I'm up all night, howling at you. Tables.
Assessment. Assess the client's usual mouth, care practices, inspect lips, gums, oral mucosa, and tongue for deviations from normal. Identify presence of oral problems such as scaring, health ISIS, gingivitis, and loose of broken teeth. Check if the client has bridge, work, or wear dentures. If the client has dentures, ask if any tenderness or soreness is present, and if so, the location of the areas for ongoing assessment. Determine the extent of the client's self-care ability. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to your client what you are going to do, why it's necessary, and how she can cooperate. Perform hand hygiene and observe other appropriate infection control procedure. Provide for client privacy by drawing the curtains around the bed and or closing the door. Before going to the client, perform hand hygiene by alcohol rubbing. Assemble equipment and supplies. Towel, clean gloves, basin, and toothbrush. Good day, ma'am. My name is Elirosejoy Santiago from the University of Science and Technology, and I will be your student nurse for today. And I'm going to brush and floss your teeth, and I will do it now. Prepare the client. Assist the client to a sitting position in bed, if health permits. If not, assist the client to a side-lying position with the head turned. This position prevents liquid from draining down the client's throat. Prepare the equipment. Place the towel under the client's chin. Apply clean gloves Moisten the bristle of the toothbrush with tepid water and apply the dentifrice to the toothbrush. Use a soft toothbrush and a client choice of dentifrice. For the client who must remain in bed, place or hold the curved basin under the client's chin, fitting the small curve around the chin or neck. Inspect the mouth and teeth. Brush the teeth. Hand the toothbrush to the client or brush the client teeth as follows. Hold the brush against the teeth with the bristle at a 45-degree angle. The tip of the outer bristle should rest against the penetrate under the gingival sulcus. The brush will clean under the sulcus of 2 or 3 teeth at one time. The circular technique removes sludge and cleans under the gingival margin. Move the bristle up and down, gently in short strokes from the sulcus to crowns of the teeth. Repeat under the outer and inner surfaces of the teeth and sulci of the gums and clean. Clean the bristle surface by moving the brush back and forth over them in short strokes. Brush the tongue gently with a toothbrush. Brushing removes bacteria and freshens breath. A coated tongue may be caused by poor oral hygiene and low fluid intake. Brushing gently and carefully helps prevent gagging or vomiting. Hand the client the water cup or mouthwash to rinse the mouth vigorously. Then ask the client to spit the water and excess dentifrice into the basin. Some agencies supply a standard mouthwash. Alternately, a mouth rinse of normal saline can be an effective cleaner and moisture. Vigorous rinsing loosens food particles and wash out already loosened particles. Remove the curved basin and help the client swipe the mouth. Floss the teeth. Assist the client to floss independently or floss the teeth of an alert and cooperative client as follows. Wax floss is less likely to fray than unwaxed floss. However, particles between the teeth attach more readily to unwaxed floss than to waxed floss. Wrap one end of the floss around the third finger of each hand. To floss the upper teeth, use your thumb and index finger to stretch the floss. Move the floss and up and down between the teeth. Give the client tepid water or mouthwash to rinse the mouth and a curved basin in which to spit the water. Assist the client in wiping the mouth. Variation. Artificial dentures. Remove the dentures. Apply gloves. Wearing gloves decreases the likelihood of spreading infection. If the client cannot remove the dentures, take the tissue or gauze, grasp the upper plate and the front teeth with your thumb and second finger and move the dentures up and down slightly. The slightly movement breaks the section that holds the plate of the roof of the mouth. Lower the upper plate, move it out of the mouth and place it in a denture container. Remove a partial denture by exerting equal pressure on the border of each side of the denture, not on the clasp, which can bend or break. Remove and dispose of equipment appropriately. Remove and clean the curved basin. Remove and discard the gloves. Perform and hand hygiene. Inspect the dentures and the mouth. Observe the denture for any rough, sharp, or worn areas that could irritate the tongue or mucous membranes of the mouth, lips, and gums. Inspect the mouth for any redness, irritatedness area, or indication of infection. Assess the fit of dentures. People who have them should see a dentist at least once a year to check the fit and the presence of any irritation to the soft tissue of the mouth. Clients who need repairs to their dentures or a new dentures may need a referral for financial assistance. Return the dentures to the mouth. Offer some mouthwash and curved basin to rinse the mouth. If the client cannot insert the dentures independently, insert the plate one at a time. Hold each plate at a slight angle while inserting it to avoid injuring the lips. The client performs soft cleaning of dentures and ensure that dentures are placed in appropriate container. Many older adult clients have dentures on foot race and risk losing them when foot rays are removed. Replacement dentures may not be recovered by Medicare. Assist the client is needed. Wipe the client's hand and mouth with a towel. If the client does not want or cannot wear the dentures, store them in a denture container with water. Label the container with the client's name and identification number. Remove and discard gloves. Perform hand hygiene. Document all relevant information. Document assessment and include any problems such as irritated on the mucous membrane.
September we met, I could tell by your smile. You hadn't been with a good girl like me in a while.